Staying thin may be a healthy fashion for most, but it can turn into something very unhealthy for a growing number of people, young women especially. It's become an obsession, a destructive addiction on a par with alcoholism. It's a psychological disorder which takes two forms. In one, the victim literally starves herself. Its name is anorexia nervosa. The other is called bulimia. It features eating binges followed by purging, either by vomiting or the use of laxatives. Both are responses to the fear of fatness. Both can be very dangerous, but they can also be cured.
I went away to college and I gained my 15 pounds. To me, for my body and my height, that was normal. I was always thin. And to me, it was terrible. I was so fat, but I wasn't. And I went to the extreme of just, making sure I lost it all plus. And once I started, I couldn't stop.
Close your eyes, taking a deep breath. And as you exhale,
I wouldn't eat for days. I tell my mom that I've eaten. I'd do exercises instead of be at the dinner table. I started fainting a lot, and if I got up too fast at any time, even if I were just sitting, I would get dizzy and my hands would shake, and the rest of my body would start shaking, and then I'd just fall on the ground.
An example of a binge would be like, all right, either at your house or like go to the store and buy food, like hundreds of dollars of food, like bags of Oreos and Doritos and donuts and ice cream and cakes, and just eat them all one time until you're so full that you can't even stand it.
What are we talking about?
This plate represents what might commonly be an anorexic's total intake for a day, which may be consumed in one meal.
Nutritionist Carla Croce has prepared a typical meal for each kind of eating disorder. This could be an anorexic's total intake for one day, some 45 calories in all, plus about 2 grams of protein.
The typical teenage girl probably requires about 2,000, 2,200 calories a day with about 40 to 50 to 60 grams of protein depending on their size, which obviously this is very deficient in meeting the body's needs. The food displayed here on the table represents what may be a typical bulimic binge. This may be consumed all at one sitting, or something like this may be consumed several times a day. The food we have here represents about 20,000 calories and probably about 250 grams of protein, which is probably 10 times the amount of food or energy that the person would require in an entire day.
I realized I had a problem. I was really scared. And
Rona, Randy, and Chris, we agreed not to use last names, are not members of a tiny freakish minority. Studies suggest that as many as a third of college-age women may be engaged in some form of eating disorder.
in fact, I was called to speak at one of the dormitories of one of the local colleges because an entire dorm floor was engaged in group bulimic practices. They were binging and purging together.
Dr. Susan Bailey is a psychiatrist who directs a hospital-based clinic for eating disorders. While the cause in each patient is an individual emotional disruption, she finds a larger cause in alterations of our popular culture, a culture that not too long ago celebrated well-fed women like Sophia Loren and Marilyn Monroe.
The media puts out an image now, not Marilyn Monroe, but Brooke Shields, that skinny is in, and women and girls especially. Girls at puberty are very impressionable and getting a sense of identity and femininity, and they look very carefully at the models that are portrayed on television and in the magazines, and what they see are women that are built like boys, and they want to be built that way too.
Males, by the way, also suffer from these disorders, but they are much more common with women. Which women? What or who is a typical anorexic, for instance? To begin with, she is young, early teens, and she has an obsessional fear of fatness.
She is also a very good student. She is usually attractive. She comes from a family that expects a lot. High expectations are important for all of these patients.
Good.
The bulimic characteristic patient is similar in a fear of fatness, a morbid fear of fatness that both diseases share. But this patient is generally older, late high school, mostly college. This is where we're really seeing the increase in incidence of this disease.
Anorexia and bulimia seem to be opposites in so many ways, and yet they often unite in the same person. Chris is such a person. At 13, she was an anorexic, but sickness and peer pressure eventually demanded a change.
All my friends and my boyfriend and everybody started getting real worried about me, and my boyfriend started threatening me. If I didn't gain some weight, I couldn't see him anymore. And so I started to try and eat something. And that was when I was about 17.
So Chris began eating and getting rid of it. She turned to bulimia.
It starts real slow. You know, I might eat about 5 or 6 cookies, and then 1 row of Oreo cookies, and then maybe 2 rows. And then as it kept progressing, I'd go out and buy food. And I would go to 3 or 4 different grocery stores and buy food. And come back home and make it and eat it, and then throw up.
Anyone familiar with grocery prices knows this is no habit for poor people. How much did Chris spend a day on hers?
A day, easily $30. That's low. Yeah, I'd say about $30. At the end, when it started getting really bad, I'd spend the money that I was supposed to be using on the phone bills or whatever bill on food.
How did she manage to keep such an expensive habit a secret from her parents?
Lied. A lot. Very deceptive disorder. Both of them are. It takes a lot of time. It takes a lot of the time that I could have been out studying or doing the things that most normal people do, and you use all the energy to plan and buy and purge and binge.
Bulimia seems to have a lot in common with alcoholism, though unlike alcoholism, abstention from food cannot be the cure, and both bulimia and anorexia seem to be catchable by example.
There's a contagiousness to it, that people read about it or hear about it, perhaps hear us speak today and get the idea. So we need to be careful that, in fact, we are presenting the dangers, the seriousness, the addictiveness of it.
Fans of Karen Carpenter learned how serious it can be when the popular vocalist died suddenly in 1983, died virtually of starvation. Actually, there are cardiological effects of both disorders that can cause sudden death, and there are other effects.
Patients who have anorexia generally know that there's a hormonal imbalance because they don't have periods anymore. They've lost much of their reproductive capability for the moment. What they sometimes don't realize is that that's just the symptom. In fact, the hormones are part of the central nervous system, the brain, and that there's much affected, other systems affected by what they're doing. The binging and purging is, of course, very damaging in many other ways, and the one we think of immediately is in the GI tract. They can, in fact, rupture their stomach through binging, and there's about an 80% mortality with that.
Chris was lucky. Her secret got out.
I had an incident with some family friends who called my parents and told them what I was doing. And my mom started checking out all the different places around the area. And so she said, well, I found this place, and she told me about it and that I'd have to spend a month there. And I didn't like that. And I yelled and screamed and ran upstairs and cried for about a half hour, and then came downstairs and decided that that was really what I needed to do, because I couldn't live the rest of my life doing that. I couldn't even live another year doing it.
So Chris was put in Dr. Bailey's care. She entered the clinic where she was required to eat 3 normal meals a day and no more, and where her problem was attacked at its psychological roots.
So you're saying that by being sick you were a little special in a way, weren't you?
Yes. It's not just talking as in a social conversation. It's painfully digging out.
Finally,
I guess that's what the whole time that you spend there is, digging out, why did it make you feel that way? Why is it that particular thing? You know, oh, what does it click with in your past?
I'll ask you now to get into a comfortable position.
As one therapeutic tool, Dr. Bailey employs a technique called guided imagery. It's a semi-hypnotic session that relaxes the patients and guides them through the exploration of their feelings.
Turn now and walk into that oasis and feel the coolness on your face. I ask them to envision an oasis, and it is essentially symbolic for their eating disorder, because it is a very small oasis that is not really a very safe place to be in the middle of the desert, because it is limited in what it can provide. And some distance from that oasis, the only thing except miles and miles of desert is a ridge of dune. Beyond that dune there are possibilities. They don't know what lies on the other side, but there's a possibility for safety, something safer than the oasis. But it means struggling across the hot sand and climbing the dune. 3. Open your eyes.
Chris and the other girls are outpatients now, but they still need the support these sessions offer. Chris had some relapses and knows she still has a struggle ahead of her.
I think I was hoping that that other side of me would be a lot stronger. I'm looking forward to the day that it is. I'd like someone to be able to tell me, oh, Christine, you're doing great. But only I can decide that.
I have some statistics to share with you that I think you'll find as shocking as I did. The youngest eating disorder patient in the Norfolk area is 10 years old, and the oldest eating disorder patient in Norfolk is 57. Our guests are here to help shed some light on the statistics and tell us what we can do about eating disorders. They are Dr. David Faber, who's with us, a psychiatrist practicing at Norfolk General Hospital, and Judith Royal, who is the program manager of the Eating Disorder Center of Virginia at Norfolk General Hospital. Thank you both for being with us. As you were watching the story that we just saw, I'm sure I watched you nodding your heads and saying, yes, yes, that's true, that's right. We talked about the age of the oldest and the youngest eating disorder patient. Is that unusual to have a child of 10 have an eating disorder?
I think for some people, when they start straight starvation, it doesn't take very long to get quite seriously ill, and I think that's especially true for someone that young.
Sure. How about the older woman, 57 years old? Is that a function of someone who started later in life or someone who just went undiagnosed for many years?
Most likely the latter, that she had had it for a long, long time, and in fact there were probably lots of people older than that who have had some degree of an eating disorder all their life, and even into old age.
It's interesting to note that most of the cases of anorexia and bulimia in our area are between the ages of 23 and 30. And the national average, we understand, ranges between 13 and 18, mirrored very specifically by the young ladies we saw in the story we just saw. How do you explain that our average ages seem to be older? Judith, how do you explain it?
Well, I think the ages you have from 13 to 18 are for major onset, but the data that you have from us is for treatment, and usually in the acute level, so that it has taken a number of years for someone to get sick enough or compromised enough they'd seek help.
We talked a bit about the signs of anorexia and bulimia. I think we've talked also about the fact that most of us know someone who takes laxatives more often than they should. How do you know if that person has a problem?
Knowing if they have a problem, I think is something best left up to experts to decide. But you don't have to be an expert to be concerned, and you should talk with a friend or a relative, whomever it might be, and suggest that they at least check out the problem and see if there is something going on.
Are people more likely, Judith, to be anorexic or bulimic, or is there a
We really
breakdown
see it as the same disease, two sides of the same coin, and that very often there is a seesaw pattern between anorexic behaviors and bulimic behaviors. So that's how we view it. There's very rare that there is a straight starvation.
I see. So it's an eating disorder situation that we have to
Yes.
worry about. One thing we talked about a bit earlier is this drug Ipecac, which you can take to induce vomiting. This is something to take to induce vomiting. This is something, of course, that I think a lot of doctors recommend to parents to keep around for small children in the event that they need to get something out of their system that's been harmful. What are the problems with using that? There certainly have been many.
Well, one of the biggest problems is cardiotoxicity, and that's the thing that actually took Karen Carpenter's life, was the cumulative effects of using this medicine for so long actually destroyed muscle fiber in the heart. And so when she began to eat normally, the heart just couldn't keep up with the extra volume of water and fluid that she was taking in, and she collapsed.
Frequently, I think perhaps that could be the cause of death in some of these eating disorder deaths. Would that be accurate?
And in fact, her therapist and physician for Karen Carpenter tried to get some control for Ipecac because of the dangers and people not knowing about it.
We have talked mostly so far about women's involvement with eating disorders. Are there any men who have eating disorders?
Statistically, we're holding with what they say the national average is, around 9 to 10%. However, I think men are very reluctant to come forward and identify themselves with what is often labeled just a woman's disorder. In addition, I think in this area, we know from our hotline calls that there are a lot of active duty military bulimics who cannot come forward for fear of being recognized.
Why do you suppose that is? Why would there be active duty military bulimics?
Well, in any situation where you have some pressure to conform to a set of standards, like the military, like performing arts, radio, television, movies, that sort of thing, wherever there's some pressure to maintain a physical criterion for acceptance, you're going to see bulimia and anorexia.
But these are not folks who are necessarily coming out of the closet, as we say, with it. They're mostly people who are calling on hotlines and not coming in for treatment.
Just like with most emotional disorders, more women are, if you will, comfortable with it than men are.
Interesting. In the story that we saw a few moments ago, most of the young people involved in that were in their teens. Is this the kind of thing that you grow out of when you get into your 20s or your 30s if you don't get some help with it?
We believe that it is chronic and progressive, and like any addiction, is without treatment is simply going to get worse.
That's very frightening, and that of course brings us to a discussion of how we go about getting treatment for it. And of course, you run an eating disorders clinic, and obviously you think that's a good approach to dealing with it.
I think that in terms of the addictive disease, that if you don't treat both the physiological problems at the same time that you treat the emotional or psychiatric disorder, a person does not have a chance to break the vicious cycle and really benefit from any kind of therapy.
But Dr. Faber, if I understand correctly, you don't agree that this is necessarily an addictive situation, and that eating disorder clinics are the best way to go.
That's true. I think the word addiction in popular usage has been robbed of its value. We hear people talking about addiction to people and addiction to fashion and these sorts of things. Certainly these are obsessive behaviors, but they're not necessarily addictions, and I think that it's incomplete to think of them that way.
So is this an addiction?
I don't
addiction
believe
to
so.
a fear of fat?
I think that it is a severe, as she says, progressive, chronic emotional illness that manifests itself with obsessive behaviors that can be misinterpreted as merely addictive.
Do you believe that one needs a specialized clinic to deal with these problems?
I think that you need a specialized person. You need someone who has expertise to determine whether or not this can be handled either in one-on-one therapy, intensive outpatient therapy, or whether hospitalization is necessary.
Obviously, though, what I hear you both saying is that this is not the kind of thing that you go to 2 or 3 therapy sessions and you're cured and life goes along its merry way.
I really think that if you look at a specialized program as a way to save time and lives, it's quicker. It's simply quicker than other types of treatment, and that the addiction, I want to clarify, is to dieting. And all the forms of purging and starvation that go with that.
In the eating disorder setting, they are inpatients most times. Is that correct?
Yes, that's correct. And in a community where they can also share with other people who are anorexic and bulimic, most of them think that they are the only ones. Yeah. They come forward and they think that the behaviors they've been engaging in, because they're so ashamed and guilt-ridden, that no one else is like them. So I think the magic of the therapy of the unit is that they find out that they're not alone.
Would you agree with that?
Oh, yes. Group therapy can be very powerful in helping with this. I think is just whether or not it's an inpatient setting or not is the only thing that I would quibble with.
But it's at least important then for them to be around other people who are suffering from the same problem.
Definitely.
Thank you both for being with us. It's been a fascinating discussion.